In terms of orthognathic surgery and its role in sleep apnea, there are a lot of different reasons why people can develop sleep apnea, and there are a lot of potential treatments of it. And in fact, the most successful or the most effective treatment for sleep apnea is a CPAP mask. And a lot of people know what that is and may even have them at home. It's a mask that you wear at bedtime that basically forces air into your mouth and into your lungs while you're sleeping. And it's very effective. But the problem is more than half the people who are using CPAP actually fail not because of the effectiveness of the machine, but because it's so uncomfortable. And so they try it for a little while and they just can't do it, and especially kids. So there's surgical interventions that really can be effective. The next most effective approach to sleep apnea after CPAP machine is advancement of the jaws. Before that, there are different levels that you can approach in lesser surgeries. So you can have a deviated septum, and that may be the cause, or hypertrophy turbinates, these enlarged bones inside the nose. And you can do a rhinoplasty and septoplasty, and that may help. Sometimes someone has a long, floppy palate, and that's a problem. And you can reduce the palate. Or the tongue itself may be big, and you can reduce the base of the tongue and try and make it a little smaller so that when you're sleeping, all those things don't go back and block the airway. Those sort of procedures at one level or another between the nose and the trachea, they can be effective, but they're of limited effectiveness compared to sort of the bigger procedure, which is an orthognathic surgery procedure where we cut the upper jaw and cut the lower jaw and move them forward. It's almost like turning your airway from the diameter of a straw to a large pipe. There's a big three-dimensional volumetric change in the airway when you move these bones forward. It's an incredibly powerful technique. It's invasive. It's much difficult than putting a mask on your face, but it's incredibly effective at ending sleep apnea. And again, when I counsel patients, it's sort of the price you pay is to live through the recovery of that kind of surgery and then enjoy a life free of masks and all the revolutionary changes that come with being able to get a good night's sleep. And we certainly know these days, all the sleep medicine research, how important a good night's sleep is to your overall health and longevity and physiology. So it is a great option for people who can't deal with CPAP or who just don't want to and get a good result.